Thank you to colleagues, particularly from across the globe, that are joining us both in person and online today. All we have to decide is what to do with the time given to us. That is a quote from J.R.R. Tolkien. I'm not an avid reader of books, but my take on that line is that those that decide to use their time to focus on tackling inequalities use their time well. Why? Because these inequalities are unfair, they're wrong, and they're immoral, and yet they're avoidable. That is the tragic story of ethnic health inequalities. These inequalities exist from maternal health to end-of-life care, and at very critical points in between those two key points in time. The fact is that ethnic health inequalities are evident in access, in experience, and in outcomes with regards to conditions that we are all unfortunately familiar with regards to diabetes, with regards to mental health, with regards to specific cancers. It cannot be right that today, in 2022, as Yvonne highlighted, black women are up to 5 times more likely to die during pregnancy, childbirth, or soon after. Asian women being up to 2 times more likely. It cannot be right that the estimated disability-free life expectancy for Bangladeshi men in the UK is 10 years lower than their counterpart white population. And of course, what we've seen over the last 2 years is the disproportionate impact of a pandemic, COVID-19, on our ethnic minority communities and ethnic minority health and care staff. So there is a level of urgency for us to focus on this agenda. And I guess in a way our country, our healthcare system should be well equipped to deal with that level of urgency. Why? Well, because we have a very long history of migration in this country and in many other countries. We therefore have large and growing ethnic minority communities. We have fairly robust legal frameworks in the Equality Act and the Health Inequalities Duties. And in this country, we've always had a very good history of health intervention. And I guess a COVID vaccine is just one example of the health interventions that have come about in this country and have been migrated out of this country. But at the same time, it can also be argued that our responses to tackling inequalities have been somewhat fragmented, costly, and confused. And whereas specific think tanks, organizations, or commissions have been set up to focus on this agenda, they have largely focused upon what we call surface level issues without looking at the causes of the inequalities that we see in our society. And that's why the observatory was set up. It was set up, as Victor has highlighted, to do 3 things, and this is our kind of operating model: to bring together the insight, the evidence, and the data. Secondly, to turn that insight into practical policy recommendations for change. And thirdly, to help and support the healthcare system to implement those policies on the ground. When we were beginning to think about establishing the architecture of the observatory, and we set up the board and various advisory groups, including, of course, our international group, to help us work on this agenda, we did one thing, and that was to look at the work program of the observatory. We were beginning to think about what is it that we want to do, and of course we had an engagement exercise, and we came away from that engagement exercise with a very long list of things that people and organizations wanted us to do. We've captured those aspects into 5 work streams that you can see on the slide, and these work streams enable us to do 4 things. Firstly, to focus on some of the deep-seated, deep-rooted inequalities in health that we're familiar with, maternal health, mental health, etc. They enable us to be reactive and proactive to the issues of the day. And of course, COVID-19 was one of the very first things that we focused on during the first few weeks, in fact, of the observatory's life, and now looking at sickle cell disease and models of care for sickle cell disease. But these programs also enable us to keep this agenda at the forefront of leaders' mind, and that's so important. Victor mentioned the role of leadership and leaders on this agenda. And finally, they enable us to do two things, two principles of the observatory. Firstly, the idea of sustained and meaningful engagement with our communities, which is absolutely essential. And secondly, data-driven evidence. That's not just focused within our own borders, but it's global. And my vision for the observatory within the first 3 years is for it to be a global player on this agenda, and this conference is a very good step towards that vision. These are some of the outputs to date over the first 12 months of the observatory's life, some very key pieces of work that we've been involved in and have led. But I'm pleased today to announce that earlier this morning we published our first annual report that you can see on the slide. In this report, we look back at the work of the observatory during the first 12 months, its vision and its impact to date. As well as outlining areas of significant change, the review also looks forward towards the work of the next few years and the opportunities that await. You will also be able to read a new paper published today in the British Medical Journal titled "Tackling Racism, Moving Beyond Rhetoric to Turn Theory into Practice," written by Professor James Nasru, who will be talking a little later today, a board member of the observatory. I'm proud that today, 1 year on, the observatory has 18 programs of work that are live and running. Some of these programs are listed on this slide. Just to name a couple: a review of neonatal testing, including the update of the APGAR score, which is also being led by the Chief Midwifery Officer, Jacqueline Dunkley-Bent. And of course, some of you will know the APGAR score, which came out in 1952. So today, this year is the 70th anniversary of the APGAR score. But judging the health of a baby based upon the color of its skin was not right in 1952, and certainly is not right today in 2022. So we will be looking at reviewing the APGAR score. We're looking at improving models of care for sickle cell disease, and we're lucky enough to be joined by Dr. Carl Reynolds, who's with us today, who's leading on that work within the observatory, and we're looking at examining the impact of long COVID on the healthcare workforce. The list goes on, and I can't go through all 18 programs of work, but it's a very extensive list that enables us to think about our definition of race and to broaden that definition as well. This is a critical agenda, and we all have a role to play in closing the gap between the promise of our ideals and the reality of our time. And that reality is reflected in that first slide I showed with all those disparities that you were able to see. And that is the purpose of this global conference, to share ideas, to look at some of the common solutions to some of the common challenges we have, not just within this country, but globally as well. And I started with the quote from J.R.R. Tolkien, and I'll finish with that quote. All we have to decide is what to do with the time that's given to us. And I hope that those tuning into this conference, both in person and online, will be able to spend more time going forward tackling inequalities and breaking down the barriers for better health for all. Thank you.